I'm working as a microbiologist in a university hospital, so I'm combining clinical work in the broad field of microbiology and then also research work, and for me this is in the fungal field. So for me the ECCMID is really a very good occasion to keep up with the new evolutions in the broad field of microbiology, and then I typically go to keynote lectures and educational workshops to update myself about new things going on. And for instance, if I think about last ECCMID, the evolutions in the conventional microbiology were quite interesting. So conventional microbiology is still a cornerstone for the diagnosis of bacterial infections, but to be impactful, we really need to speed up the process of culture identification, susceptibility testing. And what you see now is that several companies are coming out with solutions to do direct susceptibility testing on blood cultures. And I'm looking forward to see next year what will be the new things coming out on this aspect, and also the new validation data. So switching then to my research field, I think we are also in interesting times. Long time we did not have rapid tests for the diagnosis of fungal infections, or there were very few. And now we see that many rapid antigen tests are coming out or were commercialized during the last years. For instance, for the diagnosis of invasive aspergillosis, there are several rapid antigen tests. And of course, it's interesting to see what the validation data are for all these tests. And also when you go to the exhibition hall, it's nice to be able to discuss with the companies what are the practicalities of all these tests. What we certainly are still lacking is that for all these antigen tests, mainly we need bronchoalveolar lavage fluid to make good diagnosis of invasive aspergillosis, or to get a good performance in the broad field of patients at risk for fungal infections. And so it would be good, or it's really a need to be able to have a test which can be performed on a less invasive sample, such as urine samples, blood samples, or upper respiratory tract samples. If I'm thinking about invasive mucormycosis, their molecular test really improved our capability to diagnose these infections. But what's still missing there are also antigen detection assays. And that would be really a step forward, not only for the laboratories who do not have the molecular tests in place, but also for the ELMIC countries. And also certainly because most of the time what we see is that molecular tests and antigen tests are really complementary. So when we do have such a kind of antigen test, most likely we will be able to further improve our diagnostic performance for invasive mucormycosis. And then something I think that is also quite interesting is that more and more we are not focusing only on the pathogen, but also more and more on the host, and there is a search to host-derived biomarkers. And this really holds a promise to come really to a personalized diagnostic approach. And so I'm really looking forward to next ECCMID to see what will be the evolution on this domain. And of course, I'm also looking very much forward to the next ECCMID, just to be able to discuss all these things with colleagues and to think about new studies that can be set up.